My guest today is Dr. Ali Navidi. He's a leading expert in integrating psychological practices in gastroenterological care. He is the founder and CEO of GI Psychology. So, we're getting into hypnosis and the power of that in terms of helping resolve all gut issues. And it's really powerful. It's a combination of clinical hypnosis and cognitive behavioral therapy for patients with GI disorders and chronic pain. His methods are research backed and have really high success rates. They're looking at about an 80% success rate on overcoming GI issues through this approach. And he's done an amazing job building the business. You can go to gipsychology.com. They've got clinicians that you can do telehealth visits all over the country. So definitely check out their website. It's gipsychology.com if it interests you when you get done with the episode. And yeah, we're going to get into how that works and just some of the successes and insights that he's had from this approach. And then before we get into the episode, I want to remind you that if you would like to strengthen your feet and improve your biomechanics, check out Peluva shoes. Thank you to Peluva for sponsoring the show. Peluva shoes are the 5-toe articulated, toe separated shoes. They are zero drop. They're minimalist shoes that are going to allow you to feel the ground beneath you, which is, if you've never worn a shoe like this, you really need to experience what that's like. Like, put on a pair of these and go out in nature and walk around and you'd be like, whoa, I am so disconnected from the ground usually. And like understanding what I'm walking on. Like, it's hard to go back once you realize it's like, whoa, you're trying to walk on these like big, huge pads. Like, you can't even feel the ground or what you're walking on. And not to mention, obviously, it improves your entire biomechanics of your body when you are able to walk the way your feet were meant to be walking on the ground with your body standing up over them, right? So really love the shoes. They've got hiking and everyday options available. So peluva.com, and the coupon code is Coach Tara for 15% off if you'd like to check those out. All right, let's get on with it. Here is Dr. Ali Navidi. Okay, so Ali, we got to chat a little bit before the show about what you are up to. And I was wondering if you could just generally share with the audience what you are up to professionally.
Yeah, so I'm a clinical psychologist, and I've been in private practice in the DC metro area for about 13 or so years. And I've slowly developed this super specific specialty. I started out as a generalist, and over time, just because the techniques worked so well, gastroenterologists found out about me, patients found out about me. And at this point, it's like, at the point where I started my bigger practice, it was like 80% of the work I was doing was helping people with their GI problems, which as a clinical psychologist, I did not envision that's what I would be doing with my career.
Right.
So there's definitely an interesting story there.
Yeah. Can you tell us more about how that evolved? I'm curious.
Yeah. Even before I was a psychologist, I was a microbiology major, and then I worked in biotech for a few years. Luckily, like, I kind of realized with the help of my wife that I needed to follow my passion, and my passion was psychology. And I was spending all my time reading about clinical hypnosis, reading about psychology. And so really it was hypnosis that pulled me into psychology as a field. And I've been using it throughout my career. And what I didn't know is that at this point in time, there's been over 40 years of research showing clinical hypnosis is this amazing tool for helping gut problems. And I only slowly started to learn about that as I went along. And so I worked with a few patients and it went well. And then I worked with a few more, and then the doctors found out, and then they started referring to me. And slowly it became this thing that's really what I was doing most of the time. And it turned out I really love that work. And the reason is it's not like, let's take somebody with IBS, so irritable bowel syndrome. It's not actually that hard to treat it. um, using these tools. And then once you've treated their IBS, you can help them with the deeper work that they often never would get help for. So whether that's, trauma, whether that's anxiety disorders or depression, these are people that might never have gotten help for that. But, I work with them, and maybe in like 5 or 6 or 7 sessions, they're good. Their stomach is fine. And but now they trust me. Now they know, um, you know, some of the possibilities of like how they can change, and then they want to get help for these other things, right? And
Mm.
so I really enjoy that part of it, is you're treating this very physical problem, and then that is almost a gateway to help them at a deeper level.
Yeah, definitely. So with some of these patient or clients or what are patients, I guess, for you?
We go by patients, but
Patients, yes. Okay. So for
yeah,
some of for some of these patients, are you saying that hypnosis alone has helped their like IBS or gut problems, the
yeah,
symptoms resolve?
100%. Yeah. Now, so technically, what I didn't include in the story is at some point I was just full, like I couldn't see more patients.
Mm,
Um, and so I partnered with another psychologist, and we
mm,
started a bigger private practice called GI Psychology. And our goal, our desire was to make this treatment available to people all over the country.
nice.
Um, because like last count, there's like 500 gut brain therapists in the world,
Mm,
which is, to me, is crazy sauce,
mm,
because these treatments, and I don't think I'm exaggerating, they are incredibly effective and well studied. And so about 80% of people who get these treatments are going to reach their treatment goals. And
mhm.
that's coming from the literature,
Wow. Wow.
right? So we started this bigger practice, and I'm in charge of training. Um, and so at this point, I've trained like a bunch of people. We've got about like 13 therapists in our practice, and it's all telehealth, and it's all across in all 50 states, right?
Okay. Nice.
Um, so that's like, it's just like kind of the beginning of that mission,
Yeah.
right?
Wow.
Um,
Cool. Well
yeah,
done. That's a lot of work and it's amazing. So people can go to your website and they can sign up for a telehealth session through your
yeah,
website? Nice.
absolutely, yeah, and they
Okay.
can get a free consult. Um, we've got
Mm,
um, we've got a couple of graduate students who we've trained, and they can answer
nice.
the people's questions and let them know if it's going to be the right treatment for them
Mhm,
or not.
mhm.
Um, but and then the other part of it that motivated me is, um, these disorders are crazily common. Like just IBS, like one
Yeah.
in 10 people have it.
Yeah. Gut issues are out of control right now, out of control. And, it's
Yes.
interesting. It's so cool that you guys have built this and that you're doing this because most of my clients who have gut issues, which I would say is at least half of my clients at all times have
Right.
some
Right.
GI stuff going on.
Yeah.
And most of the time when we really get into it, they will say something along the lines of, well, yeah, I mean, I kind of know that I suppress a lot of emotions, like right down into my gut. Like, yep, I kind of
Yep.
know it's emotional. I kind of, a lot of them
Yeah.
will say stuff like that. And I've seen it over and over. Even the microbiologist from that created the stool testing that I use.
Yeah.
At a conference one time, I was asking him, he had a Q&A, he was a speaker, and I asked him about methane SIBO, small intestinal
Uh-huh.
bacterial overgrowth.
Yeah.
And it was so cool because he has this gut testing company. They have different, spore-based probiotics and things and all of that. And he just goes, I was like, what are your thoughts on methane SIBO? Just whatever you got. And he goes, it's emotional. It's where it starts until they get past the mental emotional reasons that created it in the first place. It will always come back. And that was really cool. You
Damn.
know, that was after his scientific explanation of
Right.
this is what all the different
Right.
bacteria do and lipopolysaccharides and leaky gut and blah, 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 blah. And it was cool to
Yeah.
hear him acknowledge that, that's he's actually coming on the podcast soon for our listeners. That's Karan Krishnan who said that. But um, yeah, I mean, I've witnessed this over and over, and but for people who maybe this is kind of like, wait, really? Tell me
Like
more.
what?
Yeah,
Yeah.
can you explain a little more about, what the basis is for this?
Yeah.
How do we make sense of this? Maybe from a more scientific angle.
Yeah. And that's a great question because on the surface, it doesn't make sense, right? When people come in and I was actually just talking to a physician's assistant who works in a GI clinic just before this podcast. And we're talking about the challenges of conveying this information to people, right?
Yeah.
Because they come into the clinic and they've got potentially very intense pain. Some of them even end up in the ER because it's so intense. They've got, you know, constipation or diarrhea. Maybe they're nauseous all the time. Maybe they're bloated and, like very clear physical effects are happening.
Hmm.
And you're telling me that I need to pay attention to what's going on in my brain? Like that's probably the biggest hurdle that people have to actually getting the treatment that'll help them. So what is actually happening is we have a brain, we have a gut, and there's a very powerful connection between the two. Scientists might call it the brain gut axis. Some people will talk about the vagus nerve, that kind of very powerfully affects our gut.
Hmm.
Some people talk about the interaction of the nervous system, the central nervous system, with the enteric nervous system. Or another way to put it is like the gut has a little brain. It's like our little brain. And we make all of these neurotransmitters. The majority of our neurotransmitters are created in the gut. And the same neurotransmitters that are having effects in our brain are also having effects in our gut. And what's happening in our gut is also affecting our brain. And so you want to convey the idea that we are not like a collection of pieces of parts, right? We're not just like a brain in a bottle, or we're not like just a gut, that we're part of an interacting system that's constantly talking to each other. And there's these feedback loops that are always happening, right? And so what happens here is that like a very frequent pattern is there's some sort of assault to the gut. Maybe it's an illness, or maybe it's food poisoning, or maybe it's inflammation of some kind. But something happens that causes symptoms in the gut. And if that persists long enough or it's intense enough, the brain starts locking in on it. And then it kind of turns on hypervigilance. It turns on catastrophic thinking. And that locking in starts creating a feedback loop where that anxious attention feeds down into the gut and starts creating more symptoms, right?
Like an analogy for life too, you know? On life outlook, really, it's like if you're
Yeah,
fear-based anxiety, everything's going to go wrong.
right.
It kind of that you keep getting that. So it's kind of
Right.
interesting.
That's I like that because like how often have I seen patients where their reaction to their fears causes the thing that they
Exactly.
fear to happen,
Exactly.
right?
Yeah.
Like who doesn't know the friend who's in a relationship and their anxiety about their partner
Exactly.
has driven their partner away,
Exactly.
right?
Yeah.
Yeah.
Yeah. So, okay, so sorry I interrupted because my brain
Oh,
went, "Ooh, that's a cool analogy."
no, no problem.
So
There's
we're in
one
this.
other piece.
Oh yeah, go ahead.
Yeah, yeah, there's one other piece that's key. So if that was just it, that would be bad enough. But there's one other piece that's key, and that's something called visceral hypersensitivity.
Mhm.
Anyone who has gut problems should know about this
Mm.
because um, it'll blow their mind, right? So the idea is that once the brain locks in a fear-based way, on the gut, whether it's, lower gut, upper GI, whether it's their throat, their swallowing, doesn't matter. Um, it creates something called visceral hypersensitivity. And what
Wow.
that is the sensations from that part of the body are being amplified and distorted.
Wow.
So, as an example, I've had many, many patients over the years who their stomach hurts in some way or there's discomfort after they eat, right? So they
Mhm.
eat, maybe they feel really uncomfortable and bloated or something, or there's pain. Um, but once we've desensitized the system, they're like, oh, wait, that's just my stomach digesting food.
Wow.
But the sensations of it were amplified and distorted to the
Mm.
point it became painful or uncomfortable.
Fascinating.
And so then what do you think that anxious brain does with those distorted amplified signals? It gets even more
Confirmation
anxious.
bias.
Exactly. Yes. Perfectly said.
Be afraid,
Perfectly
be
said.
afraid. See,
Yes.
see, this is happening.
Yeah. See, this is bad. This is really, really
Right.
bad.
Wow.
And yeah.
It's like a trauma. It's like any other trauma response in life. Like if you've been through a trauma, maybe an
Yep.
abusive relationship or something like that, and you become hyper vigilant. And
Yeah.
then, you're always on guard for it. So you're seeing it everywhere. It reminds me of that. Right. And then that confirmation bias is like, yes, women are mean or men are scary or whatever keeps
Yes.
happening. It's really similar, but on a somatic level is what I'm hearing.
And related, like if anyone out there has ever had a panic attack is another example of that.
Mm.
So a lot of
Mm.
people will have panic attacks that are focused on their breathing, right? And
Mm.
so they focus on their breathing in an anxious way. They feel like there's something wrong. That anxiety causes their breathing to start speeding up because the body feels like they're in danger.
Right.
And and they're so focused on it, all the sensations of breathing are amplified in a scary
Wow.
way. And so it starts spiraling and spinning to the point where they hyperventilate, and then they're feeling hyperventilation in addition to their breathe, so and they basically spin out of control, and they
Mm.
often end up in the ER, right?
Mm. Yeah. Yeah.
Yeah.
I had one once during the most traumatic,
Mhm.
stressful time of my life. And it is really scary. Like I thought I was like dying,
Yep.
it's really
Yep.
scary.
Yeah. and
Um,
and that's the thing to understand also is these, maybe it starts in the brain, but there's no difference between the pain that's caused from visceral hypersensitivity versus some other structural problem, right?
mm.
So it's not like you can tell the difference. Oh, this pain is coming from this, or it feels just as real as any other pain you've ever felt. Just like when you were having that panic attack, you felt like you were going to die. You know,
Mhm.
it was, there's no way of saying, like, oh, this is just my emotions getting out of control. Right.
Right. No, that's
Yeah.
not available.
No,
I
exactly.
am 1,000 pounds and sinking into the floor and what is happening, and there's no rationality available
Right.
to me right now. Yeah.
Yeah.
Okay. So I love what you're saying about like we're not just a bunch of isolated parts, because
Yeah.
even in the work that I do with the gut on the physiological level, like, sure, can we help? If- increase the health of the system. That's really like the holistic
Yeah.
approach is how do we increase the health of this whole system, not necessarily isolating all the little teeny
Right.
parts. How do we get the system to function optimally? And through healing, through this type of work that you're doing is
Yeah.
hands down one of the most important ways, because if you can get homeostasis and peace and working together, the gut can heal itself. Yeah, there might be some helpful things like some immunoglobulins or some aloe vera juice, or hey, eat some more vegetables in this case so we can feed some variety in your gut bacteria, but the it doesn't help if the system isn't functioning optimally. Like if your engine is
Yeah.
broke and you just keep pouring gas into the gas tank, it's not going to
Right.
run. And so I love that, and I'm curious, and I'm guessing the audience is too. Like, how does it work with hypnosis? Like,
Yeah.
what can someone expect in terms of like how it actually is going to help reduce that visceral hypersensitivity, or,
Yeah.
coming more into a place where they can get back into calm? Like, what could someone expect from one of these, or
Well,
probably many of these sessions?
I appreciate you asking because one of my little sub goals in getting out there into the world and doing podcasts like this is I want to set the record straight about hypnosis
Mm,
because I think it's a terrible shame that people miss out on this amazing tool for really tapping into their kind of inner potential,
yeah.
right? I don't know of a better tool for being able to do that than clinical hypnosis, but um but it's not really being pursued as it should be because um what people know about hypnosis comes from entertainment,
Right. Yeah. Yeah.
right?
They're thinking of like a hypnotist, right? Is that what
Yeah,
you're saying?
yeah,
Get confused.
there's
Yeah.
they're thinking of the stage show they saw, they're
Oh, right,
thinking of
right.
the movie that just came out. There's always another movie coming out where somebody's getting
Right.
hypnotized, some weird mind control or magic or
Right. Right.
horror, right?
Right.
Like,
I actually was in a relationship with a guy who was a hypnotherapist, and so
yeah.
people would say stuff like that to me, "Ooh, girl, watch out," or whatever. I'm like, "No, no, 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 no." He's like helping people explore their inner world. It's like a really
Yeah,
respectful, loving, cool modality. It's not this like, "I'm gonna trick you," but you're right, there is
yeah.
confusion around that. So, yeah,
And
let's
it's
clarify.
it's funny, I'm talking to Coach Tara right now, and I think of hypnosis more as my role is more of a coach, you
Right.
know,
Right.
because I can't make anything happen, right?
Right. Right.
But we can work together, and I can
Exactly.
be a guide, right? Like
Right.
if I'm like, I don't know how to lift, I want to gain muscle. I don't know how to do it. I'd hire a coach, I'd hire a personal trainer, and they would guide me, but they couldn't make me lift. They
Right.
couldn't make me put in effort, right? Like someone who's doing hypnosis with you, there's nothing they can say that will ever make you do anything unless it's in alignment with what you really want.
Right. Yeah.
And and the cool thing is, I think hypnosis helps people discover what they're actually capable of in kind of a mind body sense.
Right.
And that's why I love it as a tool. So,
Mhm.
okay, so if it's not all that entertainment stuff, right? Like if we accept that it's not that, then
Yeah.
what actually is it? Right. And I think it's pretty simple. It's just uh, teaching someone how to go into a state of consciousness called trance,
Right.
right? And we as humans go into trance all the time,
Mhm.
you know?
Yep.
Um, like when I drive to my office, I'm in trance most of the time because I'm listening to this really cool Stephen King book right now. I'm really into it. So it's like, I'm like,
Right.
oh, I'm here, you
Right.
know? um like runners, they'll get into that zone, and I saw that you're a runner also.
I used to be for many years,
Okay.
but yeah, and lifting even I get like that,
Yeah,
or a meditation, obviously that's like the goal.
absolutely, absolutely. And so and that's a similar question. People will ask me, what's the difference between meditation and hypnosis? Well, they both use that trance state, they just do different things with it,
Mm,
right? So there's a lot of similarity there, but hypnosis is just about going into trance on purpose.
mhm.
And then what happens is that in trance, we have access to this brain body connection in a way that we don't have in our normal conscious waking state, right? And as an example, anyone who's been an athlete, I played soccer for most of my life, and I can't tell you how many games I played. And when I'm done, I've got a bruise or a cut or a scrape. And I'm like, huh, how did I get that? Right. So what happened? My brain went into this active trance state where everything else faded away except for the game.
Right.
And my brain deprioritized pain. It just literally turned the volume down. So like small pains or elbows or scrapes, it just said, no, that's not important. We're not even gonna give that to you consciously. Right. Now,
Right.
obviously, if I hurt myself badly, my brain would have been like, oh, problem here. Right.
Right.
But see, that's one of the things people don't understand, that their brain has the capacity to do something like that.
Right.
They do it unconsciously, and we're just teaching them how to do it consciously. So that visceral hypersensitivity I told you about, you can literally just turn it down.
Nice.
And so people will have this experience of being at like an 8 out of 10 level of pain when they come in. 10 minutes, 15 minutes later, they're at like a 0, right?
Wow.
And it's not magic unless you consider our brains magical, which I kind of
Yeah.
do, right?
Yeah.
So
Wow.
I know
Awesome.
I went in a lot of directions in that
Yeah, I love that.
answering it, but hopefully that helps.
Yeah, it's like learning how to navigate your body, you know, is what I'm hearing.
Yeah,
Actually having that deepened awareness that you do have some sense of command of your control ship. You know,
right,
the control
right.
board, like you can actually use it. You're not like a victim of it, is what I'm hearing, kind of.
Yeah, like, and that's literally a technique I've used with hundreds of patients. I just
Mm.
call it the control center.
Nice.
So just leading people, like guiding them into that trance state, and once they're there, they can literally um they can do some stuff they had no idea they could do. So just turning down pain, right? Or I did this actually this week. I taught someone this week. They can take like some pain or discomfort and move it to a different part of their body.
Wow. Yeah, I
And if you
bet.
told just the average person, hey,
Mhm.
I think you'd be able to do this, they'd look at you like you're crazy.
Mhm.
Um, but it's actually not that hard to learn, which
Wow.
is, yeah. So like you said, you're just learning that you have more um, autonomy isn't the right word, but I'm missing the right word for it, but more sense of agency maybe in
Yeah.
terms of what you can do with your body and your mind. Yeah.
Mm. Now, I don't know if you have an answer for this, but I'm just curious. In terms of people getting to that place in the first place,
Yeah.
have you had any awarenesses? I mean, you've seen so many people of like, man, if I could have just like been there like 10 years ago and helped this person understand this or understand that before it got this bad that they're doubling over and in the emergency room or whatever, preemptively, is there any counsel, take some of these severe cases and be like, man, 10 years ago, what would you want to tell that person before it got that bad?
Well, that's a really cool question because when I first started out, the doctors didn't know about this. They weren't referring for it. So my treatment was kind of like the end of the line. Like
Mm,
people had done this, they've gotten scoped left, right,
mm.
up, down, scanned, blood test, gone through everything, fecal transplants, you know,
Wow.
and
Wow.
then they finally just kind of found their way, to see me. And, you know,
Mm,
I think one of the things for people to understand is um, saying that the brain is involved, first of all, doesn't mean it's their fault, right?
mm.
What it means is that it's really good news that they have more control than they realized. And the problem was nobody ever taught them that they had that control,
Right.
right? So I would love to get in front of these people when they first started having trouble, and it probably would be like a session or two, like that first time they start having pain, instead of going down that road of anxiety and fear,
Right.
um and just self blame, but instead to realize that this is an opportunity for them to gain a deeper understanding of what they're capable of.
Mm-hmm.
I would love to be able to do that like right at the beginning.
Mm. So in terms of like, if I bet a lot of people's curiosity is peaked right now. Is working with someone one on, I'm curious what your thoughts are on like generalized hypnotherapy sessions versus one-on-one. You know what I mean? Because you can go maybe on
Mm,
YouTube, or I don't know if you guys have stuff like that. Like,
right.
what are your
Yeah.
thoughts around that? I'm just curious.
Yeah. So I'll even put in a plug for another company too. Um, so for example, with IBS, there's a company called Nerva, NERVA, and they've developed essentially a set of recorded clinical hypnosis interventions for IBS. They've done some studies and they found that it's helpful.
Mm-hmm.
And so I think it's a nice entryway.
Mm-hmm.
And a certain percentage of people are going to be helped by it.
Mm-hmm.
A certain percentage are going to be helped a little bit, but there's still
Yeah.
going to be more. And then a certain percentage are going to be like, this didn't work for me at all. Right.
Yeah. Right.
And I'm a big fan, even though like you could consider it a competing service, but I totally don't think of that. I think anything that exposes more people to the idea that clinical hypnosis can help with their
Yeah.
IBS or their GI problems, I think is awesome. So a long answer to your question is I think it can be helpful,
Yeah.
but I think wandering the wilds of the internet is probably not the way I would do it, because
Mm-hmm.
there's some weird stuff out there, you know,
That's true. This is true.
especially in the hypnosis.
Mm-hmm.
You start typing in hypnosis and
Right.
then you're just wandering randomly around the internet. I think you can find some wild and wacky stuff.
Yeah, I can imagine.
So
Yeah.
I would encourage people to be careful.
Okay. I mean, I really appreciate your answer. I know, when we really care and what we're doing, really, it's just like anything that can help. I'm all for it, and so I commend you for, just try it out. And I totally relate. I mean, I think any of us can imagine, like, if I'm going to get a, I don't know, $50 course on how to grow my business versus hiring a private mentor on how to grow
Right.
my business, I'm probably going to get a little better results from the private mentor than the
Yeah.
$50 course. I
Yeah.
mean, maybe like you said, it might help. It might be
Yeah.
helpful, open me up to some new ideas. But,
Mhm.
obviously, when I get one-on-one attention, really diving into your own
Yeah.
stuff is always going to be a little more effective. Not a little, probably a lot more effective.
Yeah, because the obvious limitations are, it's not going to adapt to you.
Right.
It's not going to use language that fits with your personality. It's not going to
Right.
go slower or go faster or spend more time here or there, depending on your needs. It just doesn't have that. And like, for
Yeah.
example, I was just talking with one of my therapists, because I still train. I still, train them.
Hmm.
Um, and we were trying to figure out like, okay, this person has really intense health anxiety and they have, IBS. Which one should I treat first? Right. And so what I explained is you need to kind of assess to see how intense that anxiety is, because if it's too intense, it'll actually interfere with the treatment for the IBS. And so then you need to spend some time on that health anxiety, at least to bring it down a certain amount. And then you
Yeah.
can switch back to the IBS. So it's like those
Nice.
kinds of things you could
Right.
never, right?
Right.
Yeah.
That has to be made just for you. Yeah. And also just having an actual appointment versus, oh, yeah, yeah, I'm sure I'll do that sometime
Mm-hmm.
in
Oh,
and of
no, that's,
itself.
yes, that is huge. When you look at the research for self administered treatments,
Right.
abysmal in terms of follow through. And I'm sure you probably
Right.
realize that, because I saw that you have some products that are
Right.
like self-guided courses. And I think that's always been a big challenge is
Hmm.
people start with a lot of enthusiasm
Right.
and then they kind of drift
Yep.
off, or, stuff like that.
Yeah, I have a group coaching thing. It's called Level Up. And
Yeah.
I took it. I used to be self-guided. You could just do it self-guided. It goes for a year. And I was just like, nah, it's going to be group only. I can't, they're not going to
Yeah.
finish this. They need that support. They need a meeting. They need a group. They need some sort of
That's
anchor,
smart.
you know?
That's very
So
smart.
yeah, I completely agree. Like we've all bought the program or the mobility app or the
Yep. Yep.
with really great intentions and it didn't really happen. So yeah,
Yeah.
it's for many reasons. If you can at all, individual help is always the best. And I'm curious, is it all private pay? Just so I
Yeah.
know,
Yeah.
because I
So,
might be referring some people your way.
yeah, absolutely. It is out of network.
Okay.
So what that means is insurance does cover it, but it
Hmm.
covers it under out of network mental health.
Okay.
Um, but the other key thing, which is very helpful for people, is there's something called a gap exception. Another name for it is a single case agreement. And what that means is we will help the patient go to their insurance company
Hmm.
and petition the insurance company and say,
Wow.
"Hey, insurance company, do you have in-network brain gut therapists?" And the answer is always no.
No.
And so about 90% of the time, they will grant this exception, which means
Wow.
that our services get reimbursed as if we're in network.
Wow. Okay. Cool. That's
Yeah.
great to know.
Yeah.
Okay, awesome. Thank you so much. Guys, the website is gipsychology.com. You can read about their clinicians, their staff, their services, lots of resources on there. Any last words? Any last words of counsel for the listeners?
I think just in general, my counsel is you don't have to live with it. I think so many people with IBS, so many people with gut issues have gone through the ringer in terms of assessment and treatment,
Hmm.
and none of it has really helped it very much. And
Hmm.
they've kind of reached this place where they're like, "This is just my life. This is just who I
Right.
am now," and it's not true. These are very, very treatable conditions. Like I said, they're short, they're like 10 sessions on average and have about an 80% effectiveness rate. So they
Wow.
don't need to live with it.
Amazing. Well, thank you for the work you're doing. Thank you for making this more available to people. I know there was a lot of work put into that. So it's appreciated. And I'm excited to tell more people about it, especially when I get asked for, sometimes I get asked for help, but like they're not my client. It's just somebody I meet somewhere. It's nice to be able to just refer out to like, no, just go there. So I'm sure I'll be sending a lot of people your way. So thank you for creating it. And thank you for coming on and sharing with us today.
No, it was my pleasure. You made the experience great, and I really appreciate having the opportunity to talk with you and to talk with your audience. It's been
Thanks so
great.
much.
Yeah.
Hey, thank you so much for listening to this episode of the Inside Out Health Podcast. I hope this episode served as inspiration and something that you needed to hear in your life. If you have a friend or family member that you think would benefit from this episode, please share it with them. And also, please subscribe. I have so many more amazing guests coming. I have just been so gifted and honored to meet so many incredible health professionals in my career, and I cannot wait to share their messages with you guys. So please subscribe. And if you could be so kind as to rate my show, I would really appreciate it. This podcast is honestly an intuitive call to me to help spread goodness to the world. And so if you guys can help me do that, I would really appreciate it. If you want more info on this guest, pop over to my website, check out my podcast section, and you can get links to everything we talked about in the show and find out more about this guest and where you can go from here. Make sure you're also following me on Instagram. That is my most active platform. You can find me at Coach Tara Garrison. You can also find me on YouTube, LinkedIn, Twitter. Everything is Coach Tara Garrison across the board. And then, if you want to send me a message, guys, and let me know other guests or other topics you want to hear on the show, please let me know. I am here to serve you. So would love to hear from you, would love your feedback on the show. And if you share any of these episodes, please tag me on social media. It's Coach Tara Garrison.